Welcome to the LATAM Medtech Leaders Podcast, a conversation with leaders who have succeeded or plan to succeed in Latin America. Please subscribe on your favorite podcasting platform, Apple Podcasts, Spotify, Google Podcasts, Amazon Music, Stitcher, etc. Today, our guest is Dr. Daniel Uzbelger Feldman, Director of the Teledentist in Espanol. Dr. Uzbelger Feldman is the first Hispanic dentist adopting teledentistry and the first dentist implementing it in Ohio, Pennsylvania, Minnesota, and South Dakota since July 2018. Daniel has been granted with several awards on his patented cinematic radiography and low radiation dose NeoImaging breakthrough. In 2014, this concept received the Medical Device and Diagnostic Industry Dare to Design Reader's Choice Award. He is the 2013 William H. Rollins Award recipient to recognize an individual with an outstanding body of research in the field of dental radiology. With 25 years of experience, he is introducing and expanding pioneering teledentistry and dental aligner services. Daniel, it's great to have you here today. Welcome to the show.
Thank you very much. It is a pleasure to be here.
Awesome, Daniel. So let's get started with a quick introduction about your relationship with Latin America on a personal and professional level. What are you up to these days in terms of Latin America? And how do you get involved with the region?
Yes, I saw that there is a need for a better dental care in our countries. When I say our countries, I am referring to all Central South America and also Spain. So there is a very high decay index, periodontal disease, dental health disparities, and also there is a lack of dentists per population. So all this is telling me that we need to do something about it. And there is nothing better right now than introducing teledentistry in our countries in order to solve and help alleviating these problems. So we have been working very hard trying to get strategic partnerships with large companies and also small companies in our countries in order to provide these innovative teledentistry services.
Excellent. So you are from Venezuela, right? And you left the country, what year?
In 2003,
2003.
we had an opportunity to work as a faculty at the Department of Endodontology at Temple University School of Dentistry in Philadelphia, Pennsylvania. Okay. This is the root canals department.
Okay.
So I am still affiliated with them, and we do research on a yearly basis.
Okay.
And thanks to this opportunity, I was able to get my dental license, not only in Pennsylvania, but also later on in different states. And then once when I was switching jobs, I got a LinkedIn notification for an interview from a recruiter. And this was a telehealth company. So I was, very curious about the opportunity.
Sure.
And then after the interview, they told me that they were looking actually for physicians. So they thought that I was a physician. I said, no, I am a dentist. This was in September 2017. And then I asked them, hey, is there any company that is, needs dentists for doing teledentistry? You say, well, I am not aware of any. And then just 1 year later, I got a contact also by LinkedIn through this time from a teledentistry company. And then I said immediately yes, because I knew what was coming. And then I started working with them. I was one of the first dentists that they recruited. And then I helped them organizing the states of Pennsylvania, Ohio, South Dakota, and Nebraska, and also Minnesota. So, and then I saw the pain in here in the United States regarding to our Hispanic community, because I noticed that 80% of our Hispanic community here they lack of access to dental care when compared to other groups. So that pain, I felt the pain in the bottom of my heart, and I had the initiative to creating the teleodontologos, which is the Spanish-speaking version of the teledentist, in order to address the Hispanics population in our language, in Spanish. So we prepared the website in Spanish of Los Teleodontólogos. We created the Facebook, Twitter, LinkedIn, and Instagram accounts. And then we started looking at what was going on in our countries, in Latin America, Central America, South America, and Spain. And we saw actually a more, that the patients were more in more need than here because of the socioeconomic situation of our countries. So, and then we had the initiative of doing the expansion of the teledentists, or in this case, los teleodontólogos, to our countries, and now we are working very hard in order to achieve this further.
Fantastic story, Daniel. So
Thanks.
I understand you have some slides to present today to talk about that will facilitate the discussion.
Sure.
Do you want
We'll be
to?
more than happy to
Yeah.
share them with you. Let me go here. So the first slide explains the market size. The South and Central America teledentistry market is expected to reach $77 million in 2027 from $21 million in 2019. And this market is growing in a 15.7% from 2020 to 2027. It is just a slight lower this growth when compared to the global teledentistry market, which is 17.1% of growth. So the second slide talks a little bit about why the market in our countries is so in need of these services. Is because if we look at the caries index, we can see that the in our countries, patients, they have more cavities when compared to the United States patients. So what happens when you have more cavities? When you have more cavities, your teeth can break, you can have a nerve exposure, you can have a lot of pain, and you can have a swelling in the face. So actually, this is the most common reason for patients for calling the dentist or for visiting the dentist. So if we see the map, the caries index in our countries is higher when compared to the index in the United States. And what happens when the caries index is higher? Well, patients call the dentist more. So this is a direct proportional ratio.
Sure.
And this is why we believe that there is a large need of teledentistry in our countries. And in addition to the caries index, there is another very interesting map which talks about periodontal disease. So periodontal disease is when you have problems in the gums, when your gums are bleeding, when you have a gums inflammation or a gums infection, or your teeth are loose. So, and we also discovered that if there is a ratio there, that if the higher the cases of periodontitis, which is higher in our countries when compared to the United States, the more dental need is required for the patient. So there is a huge need because of this periodontal disease. Also, there is another map here which shows the number of dentists per population number, which means that it is ideal for a country to have, the higher the number of dentists per population, the better. So, as for instance, like here in the United States, but unfortunately in our countries, this ratio is not the same. So in this case, it is inversely proportional because the number of dentists is lower. Then that means that there are more dental emergencies because there is a lack of dentists. Wow. There is another very interesting map which shows the population health disparities. That happens a lot here in the United States. When I gave the example of the 80% of Hispanics that they lack of access to dental care, I'm talking about 41 million of Hispanics here in this country. Well, very similar situations in our countries. And in this case, the higher the disparities, the more dental emergencies we will have. The good news is that some efforts have been made by the Pan American Health Organization and also the World Health Organization, as we can see in the other slide, because they are promoting the use of cost-effective and simple technologies for helping increasing the access to dental care.
Sure.
So there is a very interesting work. It's a thesis made last year, and this work shows how our countries, they have been trying to catch up with this situation, and they believe that teledentistry is one of the solutions for this problem. For instance, the first country that developed a policy for implementing teledentistry was Brazil.
Brazil.
Yes, that was done actually in March last year, so over 1 year ago.
Okay.
Right, but they were the pioneers on implementing teledentistry policies. So, which means to make it official for the country. Then Chile was the second country doing the same. They did it in April last year.
Okay.
Then on May, Colombia and Peru, they follow, creating also policies promoting the use of teledentistry in their countries. And then Argentina was the last one following this study. So the way they did it is they created, first they made an assessment of the impact of the COVID-19 in their countries. And then they created resources and guidelines with, from evidence. In order to prevent the spread of COVID-19, they provide all this information to the Ministry of Health, and then they met together with dental representatives, universities, and also federations. And finally, they came out with these policies in order to provide the recommendations and guidelines to prevent and reduce the risk of COVID-19 during the reopening. And this, of course, includes teledentistry as one of the main policies. So this is a good news. Our countries, they have the same concern that we have. So, and I think that the availability of these policies in each country will facilitate the introduction of teledentistry.
That's really, really encouraging for the industry in Latin America. That's great news, Daniel.
Thank you.
So, a couple of questions. One is, what do you think the ratio of dentists versus the general population is so low in Latin America? What's happening? Why is it that we don't have more dentists?
Yes, it is very hard to say. Maybe it's the lack of enough dental schools or dental programs. I think that could be one of the reasons when compared to the United States.
Wow. And they are also very expensive, I understand. Going to dental school is...
Yes, it is, but in some of our countries, the dental schools are public schools. That was the case of my particular school in Venezuela. So the cost of the school was, very accessible and affordable for everybody. And the only thing is the materials and the instruments that you need to buy. So that's expensive. And if you don't have resources, then it could be a little bit difficult for you to pursue a dental education.
That's a barrier. Yeah.
Correct.
Itself. Yeah.
Correct.
Yeah. Okay. And the other question I have is, what's the model? What's the business model or the patient journey in teledentistry setup? In other words, when I first encountered this industry, I didn't know it existed until I connected with you on LinkedIn, and you and I had our initial pre-recording meeting, I learned about the topic, and thanks to you, and I was fascinated by the possibility. But I'm curious about how can a patient get treated if dentistry is associated with the drill and the actual manual labor involved in treating a caries or something, a cavity, I'm sorry.
Right, that's a very good question, and actually, it is very interesting that teledentistry is one of the newest, or the most recent specialties of telemedicine. As you
Okay.
know, telemedicine it has several specialties at this point, including teledermatology, for instance. If you have
Mm-hmm.
like some problem in the skin, you can show the doctor through the camera, and the doctor
Yeah.
can make an assessment and recommendations to you.
Mm-hmm.
Also, telemedicine for children. There are many, many specialties. There is one which is called for telegynecologists. That I don't know how
Okay.
they do, but
Yeah.
but the bottom line is that teledentistry, the patient experience is it follows the same guidelines that the other telemedicine specialties do. The first step is the patient, they need to log in into the portal with
Mm-hmm.
the email and then a password. Once they access the portal, they start onboarding through their medical history and the dental history and the reason for the consultation. Once we put all that, which includes allergies and medications that they are currently taking, then they go to the pharmacy part, in which they will include the address of the pharmacy, which is closer to their location in case
Mm-hmm.
we need to prescribe medications.
Sure.
And finally, they will make a payment through a very secure and rapid, portal. And
Okay.
once that they do all this together, that takes only a few minutes, then they will go to the waiting room. And one of the teledentists that we have doctors in practically every single state
Okay.
here in the U.S.
Okay.
will see the patient, and the patient should be able to show them through the camera in
Hmm.
what we call a synchronous consultation, which is in real time.
Real time. Yeah.
It should be able to provide the information that the dentist need in addition to the review of the medical history and all these, regular dental steps that we do every day when we see patients.
Yeah.
And then we will provide the patient with the best recommendations and advice regarding to the next steps. If the patient
Okay.
needs medications, excluding narcotics, of course, so we
Yeah.
can prescribe antibiotics or medications for pain. Also, we can help the patient scheduling an appointment with a dentist nearby his or her
Hmm.
location,
Hmm.
because for us it is very important for the patient to follow up with a dentist. We can
Sure.
do that next day or next 2 days. So it's very, we have a CSR, like a customer service representative, who is very an expert scheduling appointment with dentists, and also we make sure that the dentist accept the insurance if the patient has
Sure.
insurance.
Yeah.
So all these together make the patient experience with us, which is also HIPAA compliant. As you know,
Sure.
privacy and
Of
security is very
course.
important in our
Yeah.
country, and it is not the same when you know talk with your dentist through WhatsApp or
Mm-hmm.
or Messenger, where you don't have a medical history, you don't have any pharmacy address, or you can't
Exactly. Yeah. Mm-hmm.
there, and you don't have any privacy and security. So it is
Yeah.
this is why we always love to promote our platform, because it is like a virtual clinic for you.
So I will say, correct me if I'm wrong, that the majority of consultations that you guys see are for emergency type of questions, right? Somebody
Correct.
who is in pain and they need a quick fix, a quick medication, and the CVS or Walgreens in the corner, and they can manage the pain for 1 or 2 or 3 days until they see an actual physical dentist, right?
Correct. The
Okay.
most common issues are a swelling in the face,
Yes.
or a
Mm-hmm.
toothache, or
Mm.
bleeding gums, or
Mm.
gums inflammations. A lot of
Mm.
patients with TMJ problems, that's the articulation or the joint.
Yeah.
Also patients that they crack a tooth, or
Wow.
their kid was playing and then they hit the
Mm.
tooth, and the tooth is loose, and the mom or the dad, they don't know what to do.
Yeah.
So, or patients with dentures that the denture broke off,
Oh,
and
okay.
they don't know how to, what to do. In the meantime, they get the
Okay.
appointment with the dentist. So
All right.
all these things are part of the main reasons for a consultation.
Okay. That on top of the aligners, right? That you guys are now starting to promote or to address that issue of fixing
Right.
the occlusion.
Correct. The two-thirds of Americans, they have malocclusion. So, some of them, they either don't have the money to pay expensive braces or aligners, or maybe they don't have the time
Mm-hmm.
to go to the dentist several times,
Yes.
several visits in order to get the aligners. So the good news is that the teledentistry innovation now allows you to get these invisible aligners, and then you from home. So you just take the mold at home, and then you send the mold to the company, and then the company will, of course, make an assessment whether or not you are eligible for the aligners.
Exactly.
And
Mm-hmm.
your case is a case that is simple or moderate, because severe cases should go to the orthodontist, as you
Sure.
can imagine.
Yeah.
And then, if the case, after doing all this pre-screening and screening and case analysis, it goes to our clinical team, and then they make a 3D treatment plan, which is
Hmm.
shared with the patient. And then
Sure.
finally, it is approved by another dentist expert with expertise in dental aligners.
Okay.
And once we do this, then we start printing the models and manufacturing the aligners. So the patients, they just put it at home, and yeah, that's all.
Very nice. So going back to Latin America, so the idea is to enter the region with these two services, the regular dentistry consultations and mostly emergency, and then the aligners, right?
Correct.
Okay.
Because this, yes, this is a good marriage. And again, thanks to teledentistry, doing aligners at home is feasible. So,
All right. Is there anybody else in Latin America doing aligners? I haven't heard about anything yet. At least in
yes,
Colombia, I haven't.
In Mexico, there are three companies doing aligners. In Brazil, there are a couple also, but they are now trying to expand to other countries. So the dental aligners market in our countries is still very, is very green. There is,
Yes. Just starting.
it is just starting. Correct.
Yeah.
Mhm.
Wow. Same as teledentistry because I haven't seen anything yet in
Yes,
Colombia at
in
least.
teledentistry, there is no major other than, some clinics, they have it. Some private dentists, they may have it, but just for offering the service to their own patients, but not at the national level as we do here in the United States. As you
Exactly.
know, the teledentists, we are a national level, nationwide level company, and we have a partner with very prestigious companies like Anthem, Blue Cross Blue Shield, Cigna, with more than 16 million of subscribers. So
Yeah.
if one of them has a problem, as soon as they enter into the Cigna website, they will see the link
Wow.
for the teledentist,
Fantastic.
and then just
Yeah.
click, and then we are there for,
You are the preferred
providing the best
provider.
service to,
Exactly.
yes,
Wow.
to the
Fantastic.
patients. Also, we made, strategic alliances with Procter and Gamble, and with several other very large companies here in the United States.
Hmm. I'm very impressed with the
Thanks.
possibilities in Latin America. Congratulations.
Exactly. We
Yeah.
just need to do the
Uh-huh.
same,
Yeah.
copy and paste. That's
Replicate the
all.
model. Well, let's talk about the
Exactly.
model. Yeah, because and let's talk about the regulations. You and I had this conversation in the pre-recording meeting that you and I had, and would it be possible, based on the current regulation, to do something similar than in the U.S., like a nationwide virtual-only clinic, or the regulation is still kind of protecting the brick and mortar clinics?
Yes, well, actually, the good thing about the way we do teledentistry here in the United States is that we are the number one referrals to dentists now.
Okay.
Because, as you know, after we or at the end of the consultation, we always
Oh
refer the
yes,
patient to the
exactly.
dentist.
Yeah.
So if this is a patient who had like dental phobia or that didn't visit the dentist in the last 10 years, we encourage the patient to visit the dentist, and we help them actually scheduling the appointment with
Sure.
a dentist.
Yeah.
So we will do the same. We will be a great benefit for dental clinics because they will start getting patients
Mm-hmm.
from a new source of referrals that they never
Yes.
had before.
Yeah. Agree.
So exactly. So this would be great for them because what we don't want, Julio, is we don't want the patients to go to the emergency room or to go into hospitals for dental care because there are no
Yes.
dentists in the
Mm-hmm. They're
emergency
not
rooms.
prepared for this type of
Exactly. So
emergencies.
we want the patients to be seen and treated by dentists only. So
Yeah.
that's our main goal. So I believe that doing this in to the masses in our countries is feasible due to the regulations that I mentioned before.
Yeah.
They have been approved in all the countries due to the COVID-19. So
Okay. Okay. Fantastic. So the patients, I'm sorry, dentists in Latin America shouldn't fear for something like this. It is just the natural advancement of technology, and it will actually benefit them. I mean, because at the beginning, every new breakthrough innovation is seen as a threat to the establishment. But then if you really look at it, the benefits outweigh the the potential damage they will perceive that will happen to them, because they're going to get more referrals that they are
exactly,
not getting today. So and
correct,
patience, and it's really about the benefit. About it's really about patients receiving better care, as you correctly said. They don't have to go to an emergency room that is not prepared for dental emergencies. It's not
correct,
staffed by professionals because they don't have a dentist 24/7 there, and because it's not their business. Their business is other healthcare needs, not dental needs.
correct.
Yeah. So, what country, Daniel, is right now in your priority list? Where do you want to see these happening tomorrow in Latin
Yes,
America?
we think that countries like Chile, uh, Uruguay, Colombia, Peru, Costa Rica, and Panama should be very well prepared for getting teledentistry, and also, of course, Brazil and Mexico, I will add. So I think that if we introduce this innovation or this technology, it should be done in waves. So maybe wave one should include these countries that I just mentioned, and then we should focus on wave two, wave three. So
Okay, okay. And the way you are approaching each country, Daniel, is, if I understand correctly, your model is by partnering with local companies. You are not looking to set up an operation yourself at this moment. Is
yes,
that
we are
correct or
open.
no?
Actually, we are open to both. For instance,
Okay.
in right now in Mexico, we are initiating all the diligences for the starting the operations there without any need of partnership.
Fantastic. Okay.
So we need to set up the company. We need to set up the what they call the RFC, the electronic signature. There are
Sure.
many requirements
Sure.
that the country needs. However, if there is a company either in Mexico or in other countries that they already have all that and they just want to get the
The back
platform and the
office.
expert, yes, and the
Yeah.
expertise that we have and the
Expertise. Exactly.
training, the recruiting, the
Mm-hmm.
capacitation, and
Mm-hmm.
continual improvement that we can offer. So that would be even easier.
And the
So
technology platform. I mean, that's
correct, and
years,
we
years
have
of
it in
development. Yeah.
correct, and we have everything in Spanish already. Everything is
Exactly.
done.
Because
Correct,
you're already with teleodontologists in the United States. You already got the
correct. We are ready.
experience. Yeah,
Yes,
with the language and the technology front of in
correct,
Spanish.
correct.
Fantastic. Wow. Yeah, I guess uh, the opportunity is huge in Latin America. I'm sure you're going to be able to find partners because establishing your own operation in each country is going to be a very long process, right? I mean, Mexico itself, it will probably take a couple of years to, I don't know, I'm just guessing, to
Yeah, it
get
takes a little
established
bit.
or
Yes,
more. Yeah.
not that much, but it takes several months to do that. So
No, I mean to get people to learn about the service, to get revenue, to be profitable. I mean, to kind of recuperate investment and all
right,
that. Oh, I mean, it's not something that's going to happen tomorrow. That's my point.
right,
It
right,
will
right, right.
probably happen in a while. And if you don't work in parallel, which is also very expensive and time consuming, even working in parallel, because 33 countries, as you said, the first wave will probably be the top countries, but still, it's setting up your own operation is more difficult. So
It
finding
is.
partners is the way to go in each country. As the preferred method. So, what happened in Mexico? You guys didn't find a good partner in Mexico. Why did you guys make the decision, if you are allowed to
Well, the
disclose this,
the
Mexico?
Mexico is the aligners part of the business is what we are doing
Okay.
right now.
Oh,
Yes,
okay. I see. Oh, okay. Okay. And the other part of the business, the consultations are, your guys are waiting for a partner to strike a deal
for
with
the
you.
teledentistry.
Exactly.
Correct, correct.
Teledentistry. Okay, I see. I see. Okay. Fantastic. Well, Daniel, we're close to the end of the show. I am so pleased to have you here. I really enjoy our conversation today. And the last question that I like to ask you is a question I ask all my guests: is what would you say to the CEO of a medical device or medical technology company or service company that is just starting to look at Latin America as a place to do business? What would be your main advice?
Yes, I think that they should look at these maps that I share with you today, in which you can see the need of our people
Mm-hmm.
to not only to better dental care, also to better medical services as well. So I think that once they will see all this, pain, they will feel it also in the bottom of their heart, as we did, and hopefully they will try to do something about it in order to save help the people of our countries.
Sure. Excellent. All right, Daniel. Thank you so much. How can people get in contact with you, with your company?
Yes, they can find us at teleodontologos.com or also the teledentist.com.
Okay.
Thank you, Hugo. Thank you very much. Bye bye.